As COVID-19 spreads throughout the world, we learn new lessons and try new remedies. One remedy that's gaining more support in the United States, recently expressed by Mayor Walsh, is to wear a face mask in public. Experts admit the greatest benefit of a mask is for other people, especially since the virus can be spread by someone infected without having symptoms. Among those advocating the change in policy in a recent op-ed in the New York Times is the director of the Boston University Center for Health System Design and Implementation, Dr. Brian Jack. Thank you very much for being with us, Doctor.
My pleasure, Chris. Good to be here.
Doctor, I first want to start out by clarifying what kind of a mask were you talking about? Because sometimes people picture those hospital-grade masks, but you're thinking of something that's more rudimentary.
Yes, absolutely. And I think if you look on the CDC website now, they are talking now about cloth face coverings and not necessarily masks. The Surgeon General has a website up now talking about how to make your own cloth covering of your face. And that it seems as if early on, the concern was about diversion of masks away from health workers. And that was a real concern. And one of the reasons why we've been so delayed in implementing or recommending masks for people on the streets.
Well, if I wrap a bandana around my face, it's not going to give me much protection from somebody else. So what's the advantage of that mask?
The mask with the face covering?
Yes.
Yeah, so I think there are two scenarios. One is, people who are infected but are asymptomatic. And the reason, for the 180-degree turn is partly that we didn't want to divert masks away from health workers, that we have recognized that the pandemic, the severity of the pandemic, and this become very, very clear, that there's a greater appreciation for asymptomatic spread among people who are not yet symptomatic who can still spread the disease. And also the high infectivity rates of people are all have become more recognized over time since the beginning of the pandemic and have led to this recommendation now and not earlier.
One thing that occurs to me is that a mask that would maybe keep me from spreading the virus might also reduce the load of the virus that I'm spreading. Does that make a difference?
It does. So those people who are infected or pre-symptomatic is what the CDC and others have now recommended that those people wear masks, and that's where most of the impact is, and that's very, very important. So a pre-symptomatic person or an asymptomatic person can spread the disease, and we don't, of course, want to do that, and the mask can be protective against protecting other people from disease that you have. But it's also true, it's been emphasized less, that there's a decreased chance of becoming infected if you're not infected at that time by wearing a face covering also. And it's been known for some time, that even going back to the SARS epidemic, that there were some studies done that showed that family members of infected family members who wore masks were 80% less likely to become infected. So also the transmission from an infected person to prevent from becoming infected by wearing a mask is also an important thing.
For many of us in the West, when we see Asian faces wearing masks, we get this sort of a mindset about cultural determinism. But these masks, this isn't about culture as much as what people lived through recently with SARS. This is logistical, isn't it?
It is. That's a very good question. I think that the history of what's happened with the SARS epidemic is very important in the sense that that Asian countries learned a lot about pandemic response because of what they lived through before, and especially in countries that have shown a different curve altogether than what has happened in Western countries. The curves are flat in some places and like skyrockets in other places. And really one of the distinctions between those two things is masks. But masks is part of a larger preventive strategy. And that the best practices developed by the countries in Singapore, South Korea, Japan, Hong Kong, and others that were prepared for the epidemic early on was early testing, of course, and then personal protective equipment, of course, but also significant contact tracing, social distancing, and part of that package of best practices is mask wearing. And people see it as a cultural thing, but it's not. It's a preventive measure to prevent both the spread of the disease and the reception of the disease in those cultures. And I think also that the leadership thinking early on, business as usual, is that we don't have enough evidence that it works. Well, in fact, we did. We had evidence from the SARS epidemic that this package of best practices really was effective. But did we have enough evidence to recommend that, like we normally do, that every single American ought to do whatever it is, in this case, wear a mask? Is there enough evidence to say that that's necessary? But in crisis thinking leadership, we need to use the best evidence available and then common sense decisions about what works and what doesn't work. And the evidence from SARS and the evidence now that has really accumulated over the past 2 months about countries that have been using this best practices of preventive measures, having very, very different curves than the other countries, is very important evidence now that I think requires us to make this recommendation. And that's why it seemingly turned 180 degrees around from people saying there's not enough evidence for masks to saying it's really necessary to use masks now.
The recommendation from Mayor Walsh is for people in Boston to wear masks in public, period. As someone who goes out in public now very seldom, I still feel a difference between public in a supermarket or a CVS and public meaning a walk in a very big park. Should there be a different standard for those two different types of environments?
Well, I think it's a matter of risk. I think the more you are around people, going to the pharmacy and there's a line of people that are a few feet apart, going to the supermarket line a few feet apart, and where you can frequently in supermarkets and all be very close to people who could be asymptomatic carriers and spreading the disease, or even symptomatic carriers who are spreading the disease, it's important to wear the mask. I think we all agree on that now. So it's a matter of degree. So if you're taking a walk in the park and that you are not really close to people, then I think that the likelihood of either receiving the disease or giving the disease is much less, but it's still there. I think the idea of getting into the habit of wearing a mask when you leave the house is something that makes sense. I think Mayor Walsh is right that the risks are much lower if you're not expecting to be exposed to people. But the fact is, we can't be exposed to people at any time. And I think getting into the habit of wearing a mask certainly makes a lot of sense.
Do you worry at all about any kind of inequality in access to a suitable mask? Because I know a lot of us do have scarves left over from the winter time, but not everybody has a sewing machine either. So, I mean, is this a practical policy, you think?
Yeah, so I think access to the kind of cloth masks that we're talking about is pretty universal. The Surgeon General's website, the Surgeon General actually shows how to make a cloth mask, and it takes about 30 seconds for him to do that. So I recommend that people take a look at that. So we're not even talking about fancy masks or masks that need to be purchased and that sort of thing. I think there's also a tremendous opportunity. You see people around the country now who are picking up on this idea and producing masks, with sewing machines and various things. And I think that there can be a certain amount of fun in what the masks look like in various colors, and a certain mask chic that could develop and that sort of thing. That's why in the editorial in the New York Times that we wrote, we recommended that leadership of the country begin to not only social distance, but also to wear masks to show that this is something that needs to be done by all Americans. And I look forward to that happening.
It wasn't so long ago when there was a fear that putting on a mask would have people letting down their guard about social distancing. I have found since I've been wearing a mask, I've actually maybe been more conscious of that. I mean, could that possibly be happening with other people?
I think that's exactly right. Yeah. So it's important to note too that wearing a mask does not eliminate the need to social distance, and that all the recommendations are now saying that. So we need to continue to social distance. And I agree. I think the fact that you wear a mask makes it more conscious for you about about the need for social distancing. And to wear a mask and then to be close to people is not what the recommendation is, but to continue the social distancing, wearing a mask. And I agree. I think that wearing a mask is an opportunity to remind yourself continuously that you need to continue to social distance.